Please welcome the founding director of HTech, Dr. John Halamka.
Some of you actually may have noticed that over the last decade, while we've implemented so much technology, we actually may have lost the hearts and minds of a few of our doctors and nurses who are spending time on keyboards as opposed to touching patients. And of course, with innovation, we can change all of that. Now, when I say innovation, this is not just tech for tech's sake, but I'm going to take you through 5 technology ideas and tell you about how today at Beth Israel Deaconess, we have the people, we have the culture, we have the resources to fundamentally change healthcare as we know it. Okay, first, what do we have? We have data. Now, as Kevin said, in 1977, we went live with one of the first electronic health records in healthcare. This particular health record, and some may not know this, has a security scheme with 26 levels. Well, why 26 levels? It was the number of alphabetic characters we could fit in the 1977 computer's memory. Right? Back then, your computer was less powerful than your refrigerator. We have not deleted 1 byte of patient data since 1992. Now, Jeremy and Michael, a very smart man named Eric Schmidt, the chairman of Alphabet, Google's parent company, said, it's not that Google is any smarter than anyone else, but they do have more data. So this collection of data from 1992 to the present is actually a remarkable learning tool. Well, why? Because we have every patient experience from 1992 to the present to draw on. And why is that important? Well, Jeremy, suppose you need your appendix removed, but you're a young, healthy guy with no comorbidities, and Dr. Famous will be doing his surgery. How much time will we give you in the operating room? Well, remember in about 1850, that it was about 2 hours to do an appendectomy. So every hospital in the world says, 2 hours, that's what we're going to give you. But you're a young, healthy guy, and you've got Dr. Famous. So the reality is we probably need about 25 minutes to remove your appendix. But can humans decide that? Well, actually, if you have millions of appendectomies in this rich data set, we can actually figure out how much time would optimally, safe, quality, appropriate time be needed to deliver a safe and good outcome. And that's why our data assets are so important, and why technologies like machine learning and artificial intelligence that allow us to turn this data into wisdom are so important. And these are technologies that are real. These are not just speculations. This is not, winning on Jeopardy or something like that. This is taking these types of workflows, whether it's the operating room, or figuring out who needs an ICU bed, or predicting when you'll be discharged, that will fundamentally change your experience of healthcare. So Kevin and the management team today, we're talking about, when should the next patient be discharged from Beth Israel Deaconess? Well, shouldn't we use machine learning and millions of patient records from the past to figure out when the patient today is going to be discharged, and then work backward from that point to make it happen? Of course, many other industries do this already, but healthcare has been slow to adopt some of these innovations. And this is why this new center that Kevin has told you about will fundamentally, we believe, change the patient experience, and we'll have the new facilities and new technologies to make it happen. What about this Internet of Things? You may have heard about it. Now, you read the New York Times, it actually says, as you put devices in your home, it's actually Internet of Targets. We worry a little bit about all these connected devices. What are these things doing for us? Well, today on Amazon, you can buy an electronic blood pressure cuff for under $100 that sends data to your phone. Now, if you have the right app, we can send that data from your phone to your doctor, to your care team. And again, why is that going to be important? Well, imagine you're a patient with congestive heart failure. You probably know congestive heart failure. Heart's not working so well. You have too much salt, too much fluid, backs up into your lungs. You end up in the emergency room. Well, if we have an electronic bathroom scale monitoring your weight, sending it to your phone, and with your consent, sending it to the care team, we can actually figure out what is happening to say your water weight gain before you get sick. Change your medicines, send a visiting home nurse, and keep you out of the hospital. It's good for you. You are going to have better quality care in the comfort of your own home, but it's also good for society. It reduces total medical expense. It reduces the need to create more facilities. We can use those facilities for folks who are absolutely in need of them. And so with Internet of Things, monitoring your blood pressure, monitoring your weight, your glucose. In fact, there's an Israeli firm I'll be visiting, I think, in about 2 weeks when I'm in Tel Aviv, that has put an asthma detection device on your phone. You just simply blow into your phone and it will tell your doctors and nurses, it looks like it's time for steroids because this asthma patient is getting a little worse. These are the kinds of innovations we'll be exploring. Now, this seems like a complicated term. Ambient listening and geolocation. Well, what is that? Siri and Alexa, again, with your consent, you have to actually say, listen to me, can turn your voice commands into action. Why is that going to be important? Well, I'll tell you, I think, Kevin, you and I both have iPhone 10s. We're very good with touch screens or iPads or iPad minis. My 80-year-old mom thinks those are great, but would much rather talk to someone, would much rather say, when do I need to take my next pill? What is my care plan? When should I see my doctor next? Or call emergency services. So we've already created, using Alexa, 30 skills that help us in the inpatient setting and the OR setting navigate the healthcare system with voice. So as you say, Kevin, in the new building, patients could say, when will my doctor be here? What's my care plan for today? What do I have for lunch? When will I be discharged? And you instantly, as a patient, will get the answer you need from Alexa or Siri or other kinds of devices like that. Now, we do have to be a little careful because we need to think about privacy, right? And although Amazon and Google and other firms have signed contracts with us to keep data private and safe, Alexa isn't quite yet covered by those privacy agreements. So we'll be cautious, we'll experiment, and we'll only go into full production when we're sure that your privacy is protected. Now, what about geolocation? There is a technology called a beacon. It costs about $1, has a battery that lasts 10 years. In the new building, we'll be putting these beacons in our rooms. What does this mean? Well, it means that as you walk into a room, the phone that you are carrying sees that beacon and knows what room it is in. So again, with Alexa, we have created a series of skills. Where is Dr. Smith? Where is patient Charlie? Where is the nearest EKG machine? Do you know that 20% of all nursing time is actually spent hunting and fetching? It's true. And so this set of technologies, real today, already prototyped, is going to revolutionize the workflow in our new facility. Now again, a lot of buzzwords for those of you who may be in the tech industry, cloud and blockchain. Now why do I mention these? So our board of directors has quite a lot of insight. And they said, John, over the last decade, you've built 3 data centers and you've trickle replicated 7 petabytes of data across 3 geographic locations. And that's great. But what if Katrina happens? What if the whole region gets flooded? We're not quite protected against it. So our board of directors said, let us embrace the cloud. Let us, with appropriate privacy protections, redundancy, and good network connections, begin the movement of our patient-identified data to private containers, for example, Amazon. So today, we have 7 petabytes. Remember, we went from mega to giga to tera to peta. Beyond that, it's exo and then overbyte. No one's even named it yet. We've moved 7 petabytes of patient data to Amazon. And we're already experiencing the benefits of that by connecting innovative engineers, apps, and our learning laboratory to the data in that Amazon cloud. Now, what about this thing called blockchain? You may actually notice that it's in the news a fair amount, right? Bitcoin, cryptocurrencies. I did ask our CFO if we're putting a Bitcoin dispenser in the lobby of the new building. Not yet. But this thing called blockchain, it's a public ledger that is distributed across thousands of sites and is extraordinarily trustworthy. It's not run by a corporation. It's not run by any single entity or government. And why do we care about that? Well, for example, in South Africa, we've been doing some work with the Gates Foundation to help track HIV data across 65 million patients using iris scans, blockchain, and simple cell phones. The idea being that with the blockchain, we can track a visit you may have had, figure out where your data is located, and over cell phones retrieve that data. And this is so important because 16% of the population of South Africa is HIV positive. And these experiments that we run sometimes will be in international locations. South African government is sponsoring this initiative along with the Gates Foundation. And I feel if we can make it work in Soweto, we could make it work in Brookline. I mean, we will learn immense amounts from our international work. And mobile and apps and telecare. Do you know that today 80% of all the accesses of Beth Israel Deaconess websites are done from mobile devices? Chances are you, with that supercomputer in your pocket, are just going into a search engine and say, find me a surgeon, or what can I learn about this disease? You're probably not going home to the 23-inch screen on that old Dell desktop and going to a website anymore. So again, why is this important? As we think of this new system that Kevin has talked about, we want the right patient to get the right care in the right location at the right time. And very often that's going to be in your home or the ambulatory center near you. So we need a new way of thinking. This is not just a patient portal, a website you go to find out that today's serum sodium is 139. It is action, care plans, and care teams tracking your progress and looking for variants. This is BIDMC at Home, which you'll see launched shortly. It has, from the medical record, everything you should do today to stay healthy. Subjective and objective data about you. What is your weight today? How do you feel? Those are the kinds of innovations that you are going to see in the Healthcare Technology Exploration Center. And why is this front door so important? Beth Israel Deaconess has been known for innovation for many, many years. But we've not had a single organizing principle that brings together our leading technologists and clinicians, our resources and collaboration spaces, industry partners, and speaks with one voice to disseminate our innovations, to prioritize our work, and to leverage our resources. It is our view that by bringing together at Beth Israel Deaconess a truly amazing and unique culture, a single front door, we will be able to change the face of healthcare. I've been at Beth Israel Deaconess for 22 years. And why have I not joined Google or Amazon or Apple? It is because we have the most remarkable people, the most remarkable learning laboratory, and importantly, the most remarkable culture. It's an edgy culture that demands change and innovation, but at the same time tolerates ambiguity. We may, along the road and journey of the Healthcare Technology Exploration Center, sometimes try technologies that don't work. And that's okay, because then we will tell the world what we learned. So it's truly our goal, over the next 2 decades, because I have previous 2 decades to look back on, to educate the world, to improve patient care, and to, as Jeremy told us, fundamentally change outcomes by embracing these innovative technologies. So I look forward to joining you all on that journey. And again, looking across the room, I see so many people who have fundamentally shaped my journey so far. And as my service back to you, I will, in my next, say, 30 years of life, because I don't eat KFC, I think I'll have 30, return the favor, and I hope return the gift you have given me.